Today, we're tackling a topic that, because it's very rare, often carries a heavy weight of misunderstanding and fear, and that's bone cancer. Sarcomas, which account for only 1% of all adult cancers, are rare enough that public knowledge is really limited, and that leads to misinformation spreading fast and widely. Today, we're going to be cutting through that confusion and providing factual information to bring clarity and, most importantly, some hope. Hello, and welcome to Elevating Cancer Treatment. I'm Dr. Jay Chaplin. A quick reminder, I'm a PhD, not an MD. The information in this video is education and shouldn't be taken as medical advice. Every cancer is unique, and no general information applies to anyone, certainly not to everyone. Always consult with your personal healthcare provider for guidance on your specific situation. All right. Here at Elevating Cancer Treatment, we explain the science and debunk common myths to help you navigate your health journey. My background is different. Beyond educating about cancer, I'm crafting new drugs that are defining the future of oncology. This direct hands-on experience offers me a different perspective of these therapies' molecular mechanisms, and that's an insight that I'm excited to share with you. If that sounds interesting, make sure to like, share, and subscribe to this channel. Hit that notification bell, and that way you'll never miss one of the episodes. Hopefully you'll find them interesting. Also, two quick things. First, as a thank you for being here, I've created a free resource, 10 Things to Elevate Your Chemo Journey, which you can download from the link in the description. And second, by signing up, you'll also get updates on the innovative cancer treatment I'm working on. I'm confident it represents a significant advancement in immunotherapy, and I'm committed to bringing you direct updates on its progress. So take a moment, download your free guide, and join us in shaping the future of cancer treatment. Before we dive into the myths, let's review what sarcomas are. As mentioned, sarcomas are a rare group of cancers making up around 1% of all adult cases. This rarity is a double-edged sword. On the one hand, it means fewer people are directly affected, and that's a positive. On the other hand, this low prevalence translates into limited public awareness and understanding, which is precisely why myths and misconceptions can take root and spread. This rarity also underscores the critical need for specialized care and expertise in both the diagnosis and the treatment of these types of cancers. So, now that we've set the stage, let's confront the first and perhaps the most damaging misconception head on. Myth number 1, bone cancer only affects the elderly. This is one of the most widespread and dangerous myths about bone cancer, as it can lead to delayed diagnosis, and that's the last thing that you want. So, while it's true that most other cancers are significantly more prevalent in the elderly, some of the most aggressive types of primary bone cancer, such as osteosarcoma and Ewing sarcoma, are actually much more common in children, teenagers, and young adults. This is a crucial distinction. For instance, osteosarcoma is most frequently diagnosed in people between the ages of 10 and 30, often appearing during teenage growth spurts. Ewing sarcoma also typically occurs in individuals under the age of 20. Only certain types of bone cancer, like chondrosarcoma, which is not very common at all, even within bone cancers, are more commonly found in older adults. And this highlights the critical importance for people of all ages to take persistent bone pain or swelling seriously, especially if these symptoms do not improve with rest or medication. Early detection, independent of age, is key to successful treatment. Okay. Myth number 2. Another common misconception is that if a lump isn't painful, it can't be cancer. And this is an incredibly dangerous myth because when it comes to bone cancer, the exact opposite is true. The fact is, most bone cancers are completely painless in their early stages, which is when you want to catch them. Pain often indicates that the disease has advanced, or it could be a symptom of many non-cancerous ailments such as bone spurs, arthritis, or trauma. Therefore, relying solely on the presence or absence of pain can lead to a delayed diagnosis. It's crucial to have any unexplained lumps or swelling checked by a medical professional. Okay? While pain might not be present initially, certain warning signs should prompt immediate medical attention. These include an increasing size of a lump, usually at the end of one of the long bones, a change in its character, if it's becoming harder or more irregular. If there's an increase in warmth at the lump's location, that can be a sign of excess blood flow or inflammation. These can all be subtle but important indicators of a potential tumor. Many people wait for pain or a bone fracture, which occurs in about 10 to 15% of diagnoses, before seeing a doctor, which is why around 30% of cases have metastasized and spread throughout the body before diagnosis. You don't want that. Check it early. Always remember, early detection significantly improves your outcomes, so don't wait for pain to seek a medical diagnosis. Okay, myth number 3. My tumor marker blood tests are normal, so I can't have sarcoma. This myth often gives patients a false sense of security, leading them to believe they're in the clear if their routine blood tests, including tumor markers, come back normal. The reality is, at present, there are no specific blood tests to detect sarcomas. The tumor marker tests that are commonly included in health screens are very limited in their scope. They're fantastic tests, they do great for what they're specific for, but there's only a few. They can only check for certain types of cancer: pancreatic cancer, breast cancer, colon cancer, liver cancer, ovarian cancer, and prostate cancer. However, there isn't one in there for sarcomas or any of the other less common cancers. This doesn't mean that there are no indicators or risk factors to be aware of. Certain conditions can increase your risk of developing bone cancer, including specific bone disorders like Paget's disease and fibrous dysplasia. There are also rare inherited disorders. Prepare yourself for a burst of jargon, I'm sorry. Such as hereditary retinoblastoma, Bloom syndrome, Leaf-Raumeni syndrome, Rothman-Thompson syndrome, Diamond-Blackfan anemia, and Werner syndrome. Those can all predispose individuals to bone cancer. Additionally, exposure to radiation, for example, from previous cancer treatments, can be a risk factor even though it's quite small. Therefore, while blood tests are important for overall health monitoring, a normal tumor marker panel doesn't rule out the possibility of sarcoma, and it's crucial to discuss any concerns or risk factors with your doctor. Okay. Myth number 4. A biopsy or surgery to remove the tumor will cause the tumor to spread. This is a deep fear for many patients, and it's a myth that has unfortunately persisted due to past practices and misunderstandings. The belief that a biopsy or surgery would cause cancer to spread throughout the body arose because, in the past, doctors often performed whole-body staging investigations, such as PET scans, only after a biopsy. When these scans revealed that the sarcoma had already spread, it gave the impression that the procedure itself was responsible. You don't feel anything except in one spot, then the doctor tells you after the biopsy that you've got it throughout your body, you think maybe it's spread. Sarcomas don't spread rapidly. Malignant cells take quite a bit of time to mutate and develop the ability to spread from one part of the body to another, and they take a while to grow and colonize those other areas and be detectable. These days, medical practices have evolved significantly and swapped over. Doctors often conduct those staging investigations before a biopsy if there's any suspicion that a lump might be a sarcoma. You want to catch it fast. This proactive approach helps to determine the extent of the disease before any invasive procedures. On a crucial side note, biopsies are immensely important. They really are. They're not just about confirming the presence of cancer. They provide vital information about the exact type of cancer, its grade, and for sarcomas in particular, they allow for immunostains and cytogenetics tests to drive selection of targeted therapies. You really want to go the route of targeted therapies if you can, if the biomarkers are there, and the biopsy determines the biomarkers. Now, detailed information there is really essential for figuring out the most effective treatment plan and getting the best clinical response and outcome. Modern biopsies are also much safer and much easier than they used to be. Most can now be performed with a percutaneous or minimally invasive core needle punch. The core needle biopsies are often guided by radiology, such as ultrasound or CT scans, and that increases accuracy and helps avoid injuring important organs or nearby structures. A correctly performed biopsy is crucial for an accurate diagnosis, and the risk of the cancer spreading as a result of the procedure is very, very, very low. Myth number 5. Amputation is always necessary for bone cancer treatment. For many years, this was true. The words bone cancer were synonymous with amputation, and they conjured images of life-altering surgeries. However, this perception is completely outdated today. Thanks to significant advancements in surgical techniques and medical technology, amputation isn't a common treatment for bone cancer now. The fact is, The opposite is true. Limb-sparing surgery is now the standard approach, with up to 90% of patients successfully avoiding amputation in these limb-sparing procedures. So what happens is surgeons are able to meticulously remove the tumor, and only the tumor, while preserving the affected limb. After the tumor is removed, there are bone grafts, either from another part of your body or from a donor, that are put in place, or an advanced prosthetic. If too much is taken, they'll put in a metal joint or something like that, just like with a joint replacement. So amputation is really now considered to be a last resort, and it's necessary only in certain advanced cases where the tumor has extensively involved critical structures like major blood vessels or nerves, which make it impossible to preserve the limb down from there. These modern treatment options not only save limbs, but they offer patients a much better quality of life. In many cases, they're fairly minimally invasive considering what is being done. This means that many young patients who are often affected by these aggressive bone cancers, they can continue to go to school, they can play sports, and they can participate in everyday activities during and after their treatment, and that helps them maintain a sense of normalcy. All right. Myth number 6. There is no hope for patients with stage 4 bone cancer. Okay. Receiving a diagnosis of stage 4 bone cancer can be incredibly daunting and often leads to a sense of hopelessness. Now, while it's true that advanced cases don't have the highest 5-year survival rates, it's also important to understand that the situation is not nearly as bleak as this common myth suggests. The 5-year survival rate of around 27% for advanced osteosarcoma is definitely a frightening diagnosis, but that's still 1 in 4 survival rate, better than 1 in 4, so it's not an automatic death sentence the way that people will tell you, and it's certainly not the worst survival rate among aggressive cancers. As with many aggressive cancers, early diagnosis is key. If it's still at a localized stage and hasn't spread through the body, the 5-year survival rate goes from 27% to 77%. So, crucially, advancements in cancer treatment are continuous and rapid, and we have new drugs, particularly targeted therapies, constantly being developed, and clinical trials may offer access to cutting-edge treatments that aren't yet widely available. While tracking these improvements can be really challenging, particularly in bone cancer, due to changes in how tumor types are classified, the trend is clear. Survival rates are increasing year over year, every year, faster more recently. Significant advancements have also been made in the supporting care, such as the use of bisphosphonates, which help manage bone-related complications like those spontaneous fractures. We do better now than even 5 years ago, but you really want to have those targeted therapies. It's also important to remember a critical point about these survival statistics. Actual survival odds are always better than the most currently published numbers. Why? Because to achieve these statistics, researchers have to follow standard of care patients for 5 years or more, usually at least one more to compile data and publish it. This means that the data that you see today reflects treatments from 5 years ago or even further. Relying solely on these older statistics is like judging the best current car technology based on a 5-year-old model. The field of oncology is really dynamic, and today's treatments are continuously improving upon those of the past. Therefore, while a stage 4 diagnosis is serious, it's vital to maintain hope and discuss all available and emerging treatment options with your medical team. Okay. In conclusion, understanding bone cancer means moving beyond outdated myths and embracing the facts. While sarcomas are rare, they are not insurmountable, and significant progress is being made in their diagnosis and treatment. We've debunked the myths that bone cancer only affects the elderly, that painless lumps are harmless, that normal tumor markers rule out sarcoma, that biopsies spread cancer, that amputation is always necessary, and that a stage 4 diagnosis means there's no hope. Instead, we've learned that bone cancer can affect all ages, particularly teens. Early detection is crucial regardless of pain. Specialized diagnostic tools are needed, and biopsies are safe and essential. Limb-sparing surgery is the norm, and survival rates for even advanced stages are continuously improving. Navigating a cancer diagnosis, especially for a rare one like bone cancer, can be overwhelming, but armed with accurate, you have to know that it's accurate information, you can make informed decisions and advocate for the best possible care for you or a loved one. All right. Beyond these videos, if you need a deeper dive into specific treatments or medical advocacy to have your treatment be as effective as possible, I offer one-on-one sessions. I'm also currently in the process of developing an exclusive video series that breaks down every cancer drug and treatment in detail with interferences to avoid and ways to optimize efficacy. You can find information on both these resources on our website, linked below. So, what myths about bone cancer have you encountered? What have you heard? What would you like to have debunked or looked into for more details? Are there particular treatments that you want to hear more about? What are you curious about, and what are your pain points? Your input dramatically helps us expand this channel and make it more useful for you, which is what we're here for. If you found this video informative, you know the drill. Thumbs up, click the notification bell, share it with others who might benefit, and subscribe to our channel for more science-based cancer insights. Thank you.